Hello, everybody, and welcome to another Thursday Night Live. Today we have Aleena with us. So let me introduce her to you guys. Aleena is a postural restoration trained and certified athletic trainer. She holds a certification from the Postural Restoration Institute in Lincoln, Nebraska, and a master's degree from the University of Arkansas. Aleena is passionate about empowering individuals and raising awareness of the transformative benefits of postural restoration. Her primary goal is to share the science behind this approach and combine it with natural medicine, ensuring this valuable knowledge reaches, I missed my, sorry, hold on. Oh, sorry. Oh, reaches a wide audience. I'm so sorry, it cut off and I couldn't find it where I was. Welcome. Did I miss anything? So Angela
No.
Richwine is in Virginia, and she's a myofunctional therapist, dental hygienist. And she heard about you, and we love anything postural restoration. We all know that half of us need it. We do a lot of breathing exercises with our patients as myofunctional therapists. We believe that it's the beginning. Patients cannot get better if we do not address their awareness, their breathing, and their posture first. So we love you guys and we love working with you guys. If you'd like to add to your introduction, please do so.
Sure. So postural restoration is not typical posture work. So what you're talking about with like regular breathing, what I do is very different. There's only about 200 of us certified in the whole country. Yeah. So this is not something like, oh, you're doing Buteyko or, oh, you're just fixing your posture in the gym. It's completely different. And the major difference is that we are extremely interdisciplinary, which is exactly what I'm going to talk about today. So whenever you want, we can get into it.
Thank you. Thank you. Yes, go ahead.
Should I share my screen?
Yes, ma'am.
Okay. I have to make it like powerful. Oh, wait, that's a skip ahead. Let me present full screen. Oh, okay. Do you see everything?
Perfect.
Okay. So breathing in asymmetry, a postural restoration approach. It's a bit different than a lot of other approaches, a lot of other modalities. And like you just introduced me, thank you so much. I'm Aleena Kanner. I am a postural restoration provider. I'm also a certified athletic trainer, and I have really been studying movement for years. I started in a gymnastics gym when I was really young. I started to study movement at a very young age because I was so embedded into different sports. I was an Olympic weightlifter, very competitive athlete in my 20s. And my own journey has been a big reason as to why I do this today. Okay. The core focus on PRI is about faulty posture. We are looking not just at posture, we are looking at things that go beyond posture. So what you see externally does not always mean like what's going on in the body. Let me just check this. Okay. So essentially, PRI education is very different than regular sorts of movement therapies that you hear about in the world. And one of the biggest differences is that we are looking at things like pelvis, diaphragm, rib cage, cervical spine in the context of optometry, dentistry, myofunctional therapy, all the same things that you're talking about here in Airway Circle is that it has to be a multidisciplinary approach, and there is a reason for that. So postural restoration, the way I like to explain it to people is that we are looking at the sensory system and how that can make changes externally in someone's posture. Actually, the person that created postural restoration hates the word posture. It's very ironic because he feels like it's just an overused word because we're not actually looking at posture, but we are looking at posture. I'm not sure if that makes sense, but I'll get into it. So there are a lot of different PRI techniques. There are about 700, 750 PRI techniques, and that includes both manual and non-manual techniques. Here are a few of them. This one at the bottom is a cervical technique, and this one is doing some stuff with the pelvis, repositioning the pelvis. All of these techniques are very specific, and we do things on one side and we don't always do them on the other side, and vice versa. And that's I am in New York. I'm sorry for the beeping. That's a really important component of understanding postural restoration is that we are asymmetrical, which I'm going to get into. So why PRI is so different, because I've studied other things. I've studied something called FRC, functional range conditioning. I've studied some Z health stuff. I've dabbled in a couple other things, but the biggest difference with postural restoration is that we're looking at the nervous system, the visual system, the sensory system, respiratory system, muscular system, dental occlusion system, how our teeth hit together, all of these different things. How these all interact with each other form our sensory system, and how our sensory system works with our brain and positions us in space. That's what we look at with postural restoration. So the left and right side of our body are different in terms of a lot of different components. So with this picture here, as you can see, there's one liver over here. That liver is about 3 pounds on average. This diaphragm, which is not the best picture of the diaphragm, but I have other pictures in here of it. This diaphragm is actually bigger on the right than it is on the left. And then we have 3 lobes of lung here on this right side. You have your heart underneath this lung, and this heart is not symmetrical in its chambers. Your brain is not symmetrical. There's an amazing book. I'm still reading it. It's going to take me a very long time to get through. What's the name of that book? I'll remember in a little and I'll let you know, but there's a book that really dives into the asymmetries in the brain. And you actually have more right peripheral vision than you do left peripheral vision. So there are all of these different asymmetries. The left brain controls the right side of the body. We have more neuromotor, like muscular points on that right side of the body. 90% of humans are righties. There is a reason for that. So understanding that we are inherently asymmetrical is the basis of understanding what postural restoration is. So here we go. Here's a better picture here. You can see how big that liver is. You can see the 3 lobes of lung on the right and only 2 on the left, and then the heart on the sitting more on the left side. We are just inherently asymmetrical in our body, and this is okay. If we didn't have this asymmetry, we actually would walk like Lego people. Like they don't have those asymmetries, and so they're not able to do fluid rhythmic movement as we are as humans. So here's that diaphragm. The right side of the diaphragm is larger, bigger, stronger, and it attaches lower into the lumbar spine compared to the left side of the diaphragm. That's a very, very important component to understanding why people present in certain ways, why we have pain on one side of the body versus another side of the body. This diaphragm, we look at it in PRI when I'm learning, we look at everything as 2. So to me, this is a hemidiaphragm and this is a hemidiaphragm. They are 2 separate components. Sure, it's one diaphragm, but this side is drastically different. And so we need to take that into consideration when you're working in a profession like mine, where I'm trying to figure out why this person in front of me has pain and what are we going to do about it? So the liver is 3 pounds on average. It's found on the right side of our body. We have 3 lobes of lung on the right, 2 on the left. I mentioned that, but here are some better images. So external asymmetries often indicate that a person is not effectively managing their internal imbalances. What do I mean by that? If you have these normal internal asymmetries that I just showed you, we shouldn't necessarily look visibly asymmetrical. And we do because of different things that have come about in people's histories. So here's really adorable Bradley Cooper. But look at what's going on. We have one eye much higher than the other. We have a jaw that's shifting over to the left. He is in a very specific PRI patterning. I actually have to move this screen thing so I can see more about him here. We have left ear flaring. So this is a very normal, like PRI patterning. It is the first layer before we have any more layers of compensation, but he is very externally asymmetrical. I actually just did a post on him like last week about his body asymmetries and his facial asymmetries, and people really liked it. I'll probably end up doing a couple more like that, but I can send you that post if you want to link it here so people can see more about his external asymmetries, because he is a very great example of what external asymmetry looks like on somebody. Not everybody will look like that though. Well, obviously, because that's Bradley Cooper, but also because not everyone will have his right eye is higher than his left. Sometimes people have it opposite, and there's a reason for that. So the problem with external asymmetry is that when I see it so visibly on the outside, I know it's happening a lot internally. And that person's not managing those internal asymmetries. So here are some of my patients, things I've seen in the clinic. You have a lot. This is he was one of my toughest patients. He's extremely rigid personality and he had an extremely rigid body. Me and a therapist were working with him together. You could see how much lower his right shoulder is compared to his left. What's going on here is he's supinating at the right side and pronating his hand at the left. We got some things happening at the feet. These are different people. And you could see how her foot is flattening down, her foot is flattening down, and same here, lifting up here. Or well, these are actually also, this one is higher and this one's higher than this one, but it's also trying to pronate down. So it's interesting because these people both had head injuries and we don't typically see that on the left side, but you're just seeing the differences in changes in people and the asymmetries, appreciating what I see in the clinic, right pelvis much higher than the left. And we're seeing a lot going on in his mid back region, just like where his arm placement is. So just different asymmetries. This is a really common one, this left rib flare right here. That's a noticeable rib flare. We have some things happening here. We have some external rotation in this tibia. This kneecap looks extremely twisted. Both his knees do, but that one specifically. And this one, this is his, I actually saw this patient this week. This is his body. I said, lay on the table as you feel as you are straight. And this is where he thought his head was straight. So obviously that's not straight. I think most people will be able to tell that. So, okay, so asymmetries will or can lead to specific patterning in human. We can see different patterns occur in the feet, pelvis, rib cage, neck, cranium. Patterns are not a bad thing. Being stuck in one pattern is problematic because we need to be able to shift from right to left side. So in postural restoration, we're always looking at what's going on the right side and what's going on the left side. And if we are stuck over on one side and we're not able to organize our body well from right to left or vice versa, that's when it becomes problematic. External asymmetry is usually there in patterns. So these are some of the normal patterns we see. These are graphics that I got made. This, you see a right supinated foot, that means it's lifting upwards, whereas the left foot's a little bit more flattened down into the ground. They did a good job. It's not perfect. It's still a graphic. We have a pelvis here with the left side really being flared out, coming into external rotation and abduction. So it's coming out like that. And the right side is doing the opposite. It's kind of coming backwards. So it's internally rotated and adducted. And because of that, we have changes happening here at the femurs in response to what's happening at the pelvis. The sacrum is looking to the right. If you put eyeballs on the sacrum, it would be looking to the right. So, oops, sorry. We have this person here, which is a very common thing that we see where an entire center of mass is coming forward. And the issue with that is that we start to lose our curvatures. We should have 30 degrees of curvature in our cervical spine, 30 degrees of curvature in our lumbar spine, and we will end up losing our curvature. So this is more of a normal human, and here we have that forward head posture happening because an entire center of mass is coming forward. The problem with treating just forward head posture is that you're missing everything underneath the neck. So if we're just doing chin tucks all day, like what's the rest of the body doing? If those ribs are flared up, chin tuck's not going to help. So that's why this is like an extremely holistic, comprehensive approach to look at everything. I would never treat somebody's neck pain without looking at what they're wearing on their feet. It's very, very important to look at everything. So these are just some more things. I don't know. Can you see where this bubble is of where my head is, or?
Yeah.
Okay. Is it in the way? Because I keep moving it.
No, there's nothing in the way whatsoever, actually.
Okay, great. Perfect. So here is another graphic where you can just see what a lot of people will come in with. A lot of people will come to me in pain, and then I need to look and figure out why. And I need to look not necessarily at where they have pain. I have to look at what their entire system is doing. So we really need to dive very, very deep into breathing. And that's my first way that I treat people. So if somebody comes into me and they're like, yeah, I have this neck pain all the time, but then they're coming in and their feet do not know where the ground is, like I have to know where to start. Some of it's gut instinct, some of it's experience, some of it's learned material that I've picked up on. So it's not, breathing is how we start everybody. It's always part of the programming. It's not always the answer for people. It's always the answer as in everybody needs to start there, but you can't always breathe your way out of a problem. If you have a major dental problem, I could do all the breathing in the world with you, but until we fix what's going on here, that's not going to work. If you have a visual problem, you have an eye turn, like that's something that we need to look at as well. So this is more about that asymmetry that I was like mentioning before. This is like an amazing, the Statue of David is like the absolute best image to talk about this asymmetry. And that's because he is standing primarily over his right leg. His right shoulder is lower than the left. So as you see this image, you can see that his neck is centering over his right leg. Sure, it's because he's turned, but this is what we call right stance. So it's just an interesting concept that they sculpted him like this, because this is the position that I see that neurologically we tend to organize our body more over the right leg compared to the left. And that is because of our internal asymmetries that have pulled us over into these different patterns. This is right stance. That is one pattern we see. We need both right and left stance to accomplish the normal human gait cycle. So when we see excessive patterns or tightness that is presenting in different patterns, we can lead to injury, pain, and dysfunction. So just a quote that I thought was good, but we really need to be understanding every single component of the body to be able to help people. We can't just gloss over little things like, oh, you got a tooth pulled. To me, that's a very important fact as to why somebody might be in pain. So we have to look at everything. Okay, so cranial cervical motion, and some of you guys might know this because I know that there's like a lot of dentists and myofunctional therapists, but when I look at cranial cervical motion, it's really important to know that we have a little bit of movement and flow in every part of our system. It might be easier to know that our ribs move compared to our cranial bones. I know that cranial bones have been a controversial topic with, do they move for years? But this is what happens when you inhale and exhale. I will start to play it again. So they move slightly, and that little bits of movement can be obstructed by a couple things. Head injuries being a huge thing, permanent retainers being another huge component, braces, and that's okay. Sometimes people need braces to feel better. I'm a big fan of that, especially when done at the right timing. But the problem is when these cranial bones get stuck in a pattern and they don't have this little rhythmic flow and they lock up, and then we test the neck and we can feel it in the neck, or we could test the ribs and we could feel that in the ribs. So temporal bone, we do see different asymmetries that are kind of happen in the entire system. So I'm gonna just keep telling you all about the asymmetries because it's really important. Temporal bone asymmetry usually presents with the right temporal bone stuck in internal rotation and the left in external rotation. And what I mean by that is if like these are your temporal bones because they sit right about here, your right one would be more turned in, your left one would be more turned out. So when we see how we look at that, we look at ear position. If one ear is flared more than the other. And like Bradley Cooper, an amazing person to look at, he has a left ear flare because his left temporal bone is in a state of external rotation. That is not necessarily a problem if his left temporal bone can internally rotate when he stands over on his left leg. I just don't think he can because he's so externally asymmetrical. Mandible, I know that dentists definitely know this, that jaws can deviate and they can go in either direction. You could see it with different people's dental occlusion and what's going on with the teeth. We look at the mandible and the TMJ joint in general with what is going on with the temporal bones. If the temporal bones are moving or stuck in a certain position, maybe the mandible is going to follow with it. We typically see most people have a deviation to the left. There is a reason for that. It's because that left temporal bone's in external rotation, right's in internal rotation. So what happens? The jaw moves this way. But there are people, of course, that have deviations going to the right, and that patterning is just more complicated. It's more of a torsion, twisting patterning happening in the cranium, and it needs to be addressed. And those are the people that are really, truly struggling. And those are also the people that braces needs to be done really at the right timing for them. We need to really be looking at that body first, and they need to be untwisting the rest of their body really before braces. But braces can help these people. So many experts attribute TMJ issues to the misalignment of the mandible with the temporal bone, especially at the mandibular condyle. While this is important, we shouldn't overlook the influence of other cranial bones on the temporomandibular joint. It's kind of what I was explaining before. I think that a lot of people don't understand how much of an impact like the sphenoid and the temporal bones play on the mandible. So maxilla, just kind of just going through all the bones, we will see that all the cranial bones play a role with how people are essentially feeling on a day-to-day basis. And then the sphenoid bone, which is a really important bone, and we will do, obviously with craniosacral therapy, a lot of our stuff is taken from some craniosacral therapy, especially upledger, but the sphenoid positioning can really relate to where your eyes are. So if one eye is much higher than the other, and we will see that typically the right eye will be higher on most people. If you go back and look at that Bradley Cooper picture, his right eye is higher than his left, and that's a normal, what we call right TMCC patterning from PRI. So these are all different asymmetries that we see that need to be addressed, and need to be addressed not through forcing anything. And here is just, I just honestly love this little video of the sphenoid. I think it's so cool. It looks like a butterfly. I just think it's a cool video. I'll just let it play.
Girl, we're geeking out.
Oh, really?
We love this stuff. Oh my gosh.
How cool
They're
is this video?
beautiful.
I'm so glad. Great. I am glad. So cervical spine, now we're going to get a little bit more into, the body here. Cranial asymmetries occur, so do cervical asymmetries. And we will see different layers of every type of asymmetry. So like I mentioned before, there's kind of like one pattern, and then there's another layer of compensation that happens on top. Just because sometimes people will read about postural restoration or watch a video and they'll be like, oh, all these symptoms make sense and relate to me. And then it gets into talking about the patterns and they'll be like, oh, that doesn't make sense. Just because you have a jaw going to the right, for example, does not mean that you're not in a pattern. You are. We all are. That's okay and normal. When it comes to the cervical spine, this is a really important testing mechanism for me. I rely a lot on my neck testing. It honestly took about 2 years for me to get good at testing the cervical spine. And I was doing it every day in the clinic when I was mentoring under my mentor in Texas. And it took me a really long time. I do not think that everybody knows what they're feeling there. I would say that I'm much better at testing a cervical spine than I am at feeling cranial bones. I'm not a craniosacral therapist. That takes years of practice to actually know, like to feel things and know where things are. It's years of work. So with the cervical spine, we are looking at things like lateral flexion and rotation to see where does the head center on the body. So when I test lateral flexion, if I can flex all the way this way, it means that my neck is able to go over my left leg and I'm able to now laterally flex my head. But if my neck is centered over my right leg and I try to laterally flex, it's not going to go. So I think there's some videos in here later, and if not, I'll pull some up of me testing a neck and like what we're really looking at. So we do see limitation in rotation to the left and lateral flexion to the right. Ooh, what's wrong with this video? So also I thought this was a cool video too. I feel like it looks a little different on here, but yeah, just the like bones in the cervical spine. We have a head and neck that typically centers over the right side of our body more than the left. And we do see that the cervical spine actually will orient, which means like look in a certain direction. So it doesn't actually look like this picture. Like that picture is not perfect. Let me go back. This is obviously a screen recording, as you can see. This is not actually how a cervical spine looks. We're going to have different rotations happening at different parts of the cervical spine. So understanding that, if you go and get a cervical adjustment, like I love certain chiropractors, I'm a fan, but you have to be very careful who you go to, because you go and just adjust that spine and they don't know what position that cervical spine is in. It could be problematic. So it's really important to understand asymmetries. It's just crucial for being able to treat anything properly. Obviously, that's what I study, so I'm biased. I think that asymmetries are vital. I've also seen some crazy cases with vision and dental, and things change significantly from actually addressing these asymmetries. How can we change our natural human asymmetry? We can't, but it's okay. We have to just learn how to manage our external asymmetries and get to a point where we're balanced. That's really the key. So how do we elicit change? Postural restoration providers will influence the body, specifically the nervous system, with 5 senses, which a lot of things today do. In different types of therapy, they do different types of meditation. They're bringing you awareness of where you are in space. There's a lot, somatic therapy, there's a lot of different things. The biggest thing that we are doing is that our techniques are very, very, very specific. They take years to really understand to be able to communicate effectively. And then we also are implementing the visual system and the dental occlusion system. So in order to breathe properly, belly breathing, I'm not a fan. I know that a lot of myofunctional therapists, especially lately, I was seeing some articles and reading and Instagram, a lot of people are promoting belly breathing. If you have questions on this and you are doing belly breathing in your clinic, please just reach out to me. I will, no problem, explain to you why I'm not a fan of belly breathing. For right now, I'm going to talk about it, but not like obviously as in depth as I could. When we breathe from our belly, we have to allow for the contents of our belly to spill out forwards. So we are essentially losing energy there, if you think of it like that. In order to actually get breathing done optimally, the goal is to get our rib cage to come down and our diaphragm to dome up. So here's this optimal breathing. When we inhale in, everything will move. If we just breathe from our belly and we inhale only here, everything's going to dump forward. Your pelvis is going to dump forward. Your rib cage is going to dump up. And the problem with that is then you're never able to get a successful doming of inside at the diaphragm. That's a problem because then this diaphragm is going to stay flat and you're never going to be able to dome it up. So if you think of yourself like your diaphragm is this way, I mean, I can go and get my rib cage actually. Maybe I will. Hold on.
I love this. And I love as you're saying it, I'm trying. And I think I understand what you're saying. Whenever we breathe in, it's supposed to fill up this way instead of us teaching people how to push it out this way.
The problem is you can't do it in that position. You won't get it. And that's because you've never practiced in a different position. It's not even just laying down, and you'll see you can sort of, you're going to get it better, but in order to get expansion in one place, you have to compress in another place. So that's what I wrote here. So in order to do that, you have to put yourself in a position for success or failure because it's really hard to do. So whatever way you want to look at it. So the problem with belly breathing is this is what happens. You're going to inhale in, exhale out. Inhale in, exhale out. So what are you doing all day? You're doing a back exercise. Well, that's not how you're supposed to breathe. The other thing we see with belly breathing is people will just lift up. They're going to pull up. Okay. We actually need chest expansion. We need to be able to expand this way. Inhale.
So what is this whole thing of people teaching? Put your hand in your chest and hand in your belly and only your lower hand
wrong.
to move. Oh, thank you.
Straight up incorrect. Straight up incorrect. It's one of my biggest pieces of knowledge that if somebody can watch this and go home with today, don't do that. We want our belly to rise and we want our chest to rise. Our lungs live up in our chest. The top portion of your lung is in your chest. It is so, so important to be able to get air up here. People say chest breathing is bad for you, but they're really talking about when your neck pulls up on the rib cage. That is not good for you. I would agree. That's your neck having to breathe. Your sternocleidomastoid is having to breathe all the time. You need to learn how to inhale in. The diaphragm will flatten because everything is moving out, and then exhale, and inside here, the diaphragm domes up on the exhalation.
Thank you for explaining that.
Domed, and then you can inhale in again. So that is very, very, very important. And I know there's a lot of myofunctional therapists talking about breathing, and it's really hard for me because that's my world.
Yeah.
And I really want to just get people out there understanding that how they're talking about breathing is so important, because if you have somebody come in after they've been doing a year of belly breathing and I see them, that is really hard to untwist.
Yeah.
Like that is hard. And I've struggled with it. So I hope that helps. And I do
Please, that
have
would be
techniques
incredible.
in here. I think I have some people doing some breathing techniques in here. And if
Awesome.
not, I'll pull one up.
Okay.
So this is another image. You could see this is a flattened out diaphragm, and this is one that's domed up. The only way this diaphragm is domed up is because these ribs came down. As you exhale, all the air comes out. Inside, that diaphragm can dome up. So being able to fully exhale, pause, keep that like integrity of the ribs being slightly down, then inhale into the chest and getting expansion in the chest, that's what changes posture. Yeah.
I love you already. Incredible.
So just some more. Here's that diaphragm. It's just an important component. And then exhaling, diaphragm moves up. It domes up. It's very important. So the other component of respiration that people don't talk about is this area called your posterior mediastinum region. This will never happen if you're doing belly breathing, because what happens with belly breathing is you're just dumping out, you're leaking energy out forwards. So posterior mediastinum is this region right here in your upper back that people always feel like they need to roll out or crack. It's because they don't know how to get air there. And I know that because I was a gymnast and I used to do that all the time. I always needed to roll my back out. I needed people stepping on my back. It's a call for needing airflow. That's what that is doing. If you're someone who feels like you have to always get a foam roller and do that, it's not because you have to do that. It's because you need airflow. So what happens all the time with belly breathing is you get kinked kind of into your upper back, right? So you end up like this. And so it's almost like someone's kneeing you or punching you in the back all the time. And the problem is that these ribs in between get really compressed. And so you're unable to get air there, but you have lungs that live up there. So what do? We help get the body into a certain position to help elongate this area and get airflow there. And also, mind you, your vagus nerve runs through there. So if you are a stressed out person and you want to calm down fast, getting air into your posterior mediastinum is key. So just PRI techniques are really important. And the biggest thing is that you really want to be looking at the body before we do stuff with the cranium. So depending on, like, we need these sensory inputs to make changes. So all our PRI techniques have a component of like touch, or can you feel this? What muscle is activating? Even if you're laying on your side, we're getting peripheral vision on one side. Sometimes we'll have people touch their teeth together on one side compared to the other. There's a reason for all that. We collaborate with dentists, optometrists, and podiatrists. That's one of the biggest things that's different in my world compared to like other physical therapists, chiropractors who don't practice this specific modality. Integration is really, really vital. Even foot orthotics, I do help people make, I don't make the orthotic, I do the casting for it, but I would never do it on a first visit. There's always stipulations involved. Even when I do it, the person has to be neutral on the table, and then we do it in a very specific manner. I am not a huge fan of most foot orthotics. I have honestly only ever seen one other pair that compares to the one we make. So most hard, rigid foot orthotics are not good. When we do eye appointments, I just had one yesterday. We do we always look at the gait. We are always testing the body. And then for many patients, we're doing what we call a standing refraction. So we're testing their eyes while they're standing. Same with the dentist. We do the adjustments to the guard, the appliance, which is a mandibular flat plane splint. We do it standing. So neutrality is kind of a hefty topic, but it's kind of what we were talking about before. Person can organize your body over the right leg and then be able to organize over the left leg. It's that transition zone of being able to do both. And that's really key in getting people as the starting point to get out of pain. So as you can see here, this is what happens when you belly breathe. You become extended. And a lot of people will be like, oh, well, my head's coming forward, my shoulders are like rounding. Why is that happening? Because you're so kinked that now your brain is like, I can't breathe, I'm going to round forward. And then you get that kyphotic person who still needs the same stuff of getting air into the upper back and getting air properly into the rib cage. So, and then of course, this is more what we're looking for. This gives the ability for the diaphragm to move in full range of motion. What's also hard is we walk forward in space in life. So when we walk forward in life, we're more likely to become like this on one side compared to the other. This person is like that on both sides. neutrality. We want 30 degrees of lordosis in that cervical spine. This is, you know, somebody whose gaze is looking more down. They've lost that 30-degree range of motion. This is a forward head posture waiting to happen if it's not there already. So we want that curvature of the neck. So the problem with just pulling your head back is that it's literally pulling your head back on a straightened C-spine. So chin tucks are not ideal. And then, of course, the dental occlusion, we want that to be a flat plane. Here are some techniques of people doing things. Like this is something with a patient. I would never have him do it on the other side. I would only be doing it on this specific side. These are the techniques from the beginning.
Upper back. So inhaling in, exhale, blow it out. Blow, 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 blow. Weight stays
Significant
back in the heels.
exhalation.
You might even notice that your quads are really working or shaking. That's okay. Do one more breath here, inhaling in, getting air into that back. Exhale, blow all that air out. Gentle press down on just the exhale. 4 to 5 breaths and 4 to 5 sets. And when you stand up, press through your feet to slide your butt up the wall.
So that's, I have my own course. It's called Rooted Well, and this is part of the foundations course. The other course I'm coming out with, which is Rooted Well Advanced, is going to be way more dental and vision stuff. But for this, like this technique is something you can start with anybody with. So I have this technique in here, obviously the full technique, but why it's so important, if you look at him, let's see here, he's super rounded. So he's able to get air into his upper back because he's compressed here in the front and expanding here in the back. So it's really important to get air where it needs to go. And the only way to do that is to compress in some areas and expand in other areas. And so this is a postural restoration technique. All my stuff is postural restoration techniques with my interpretation of the technique. But this can make such a significant difference for those people that are like very go, 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 very stressed out all day. They worked all day, they come home, they can't wind down at night. This is an amazing technique for someone who's in braces. Like if you're in braces and your cranium's getting locked up, like what's better than opening up your rib cage and making sure that moves efficiently so that your braces pathway can be faster. So that's why working on the body is so, so important. I have seen people's braces experience, Invisalign experience, teeth move faster than they should because they're doing body work. So here are more techniques.
And then come to the right.
Look at how much twitching.
Forwarding to the left.
Keep pushing that ground away even
Wait.
here.
Okay, do it again, go to the right.
It's really hard for her to keep her jaw forward and just be able to
You
move.
feel it?
Mm-hmm.
You're just not used to it. And then try the left again and tell me which one feels easier. Left. Yeah.
That's twitching as a response because she has no idea how to move her jaw independently from the rest of her cranium bones. And I know that this is probably something done in myofunctional therapy, but this is a zoom in version as to you can't see what's happening underneath. But like I did this, I teach them first like this, and then I stand them up and I do the rest of the body. This is happening as she moves her body on one side and then onto the other side. Because as you walk in space, and you take a step on your right leg, your jaw slightly moves to the right, and then your jaw slightly moves to the left on the left leg. If your head is not letting you do that, it's gonna stay locked up. So that's why it's actually so important for weight distribution on the foot to also happen when jaw is moving. So it's not just about what's happening at the jaw. It can't be done in isolation. This is proper posterior mediastinum expansion into that upper back. So this person I remember did a really good job.
Inhale in.
You see how much airflow?
Nice job. Blow up.
You should be getting airflow here.
Keep pushing that ground away even here. Good. Pause. Reach that ground away. Do one more. Inhale in.
That's all airflow.
Good. Exhale. Blow.
She loses it, like as she's exhaling, she does lose it, but she did get major inflation into her upper back. So we do work with dentists and optometrists. It's really important that we have the patient have a proper ground underneath their feet before we work with a dentist and optometrist. And sometimes that's easier said than done. My patient I saw yesterday, he cannot get a better ground underneath his feet. I did as best as I could. His pelvis was neutral, his ribcage was neutral. I had to go to an optometrist, and we're going to help him. And the prescription is definitely going to help him. And now his neck will be neutral and we'll be able to make some of these changes. So this is us working together, me and one of my dentists. I have 3 that I work with in New York City. So how your teeth contact is going to, whether you like it or not, is going to make a change as to how you feel in your system. When people take out one tooth or lose a tooth because of like, I don't know, maybe they needed to get a tooth pulled, maybe they cracked it. That will change the input given to the brain. And that can be detrimental for some people and okay for others. It just depends on the person. It depends on where that person is. The periodontal ligaments are one of like the sensory components that bring sense back to the brain. So being able to have a nice full bite on a body that understands neutral, being able to go right and left, that's the ideal situation. Sometimes we need to work with a flat plane appliance to get people to feel that. So these are, what are the splints? They're made out of acrylic plastic usually, or honestly, this one is nylon. Oops. A lot of places use acrylic plastic. I did start working with more of a biological dentist because some patients have allergies to acrylic plastic. So this one is nylon. And it allows that patient to have a full sense of his bite. So even if his teeth don't hit well during the day, like at night, he puts it in, he goes to sleep and he feels a lot better. And then when he wakes up in the morning, he can continue his day. And that new feedback, that new sense he had all night kind of sticks around. This has to be done in collaboration. We do the appointments together and we do the adjustments standing. And there a lot of what the patient is sensing, as well as what I'm looking at and what I'm seeing, and then what his body tells me, or whoever's body tells me. These are the two different appliances we use. My more biological dentist doesn't really do one with the metal, but we do like this, and then I have another dentist that will do one with the metal. So it's case by case dependent who I send people to. But you can't really go wrong with trying one of these out for somebody who's in significant amount of pain. There's just, it's a timing thing, order of operations. This is not the day one. This is never being done day one. But as a dentist, if you're a dentist and you're working with somebody and they've tried everything, they're in a lot of pain, you can't figure it out. Like, this is a great idea to test it out. Of course, even if you don't have a provider with you, you can still try and do the adjustment standing and make sure they leave feeling like they have a nice full bite. So this is, I think, his splint. And this was a video showing how I do it. But you can see he has trial lenses on because we did his appointment with glasses. So we went 2 days prior, got him a new pair of glasses, and he was visiting. So we had to do it a quick turnaround, and we took the lenses to the dental office and we did the dental fitting with his new lenses on, because that will actually change how his teeth sense. Same with optometrists. So how your body makes decisions about the world and how your brain understands the environment has a lot to do with how your vision is. So how your eyes work together. It's not about how well you see, it's about your vision. How do your eyes work together to understand where you are in space? So the goal is to make sure that people are what we call neutral during an eye exam. And we try and do things standing. That's a big thing. I even buy them a stool so that they can stand on something. Yeah, the biggest thing is standing, and me and the optometrist work well together to figure out what's the best for the patient. Obviously, there's a lot more variety with vision, as it like it's different than dental in that way. Like with dental, like, of course you can go and get braces. There's a lot of different ways to do that, but vision is way more variable, I think. Also more difficult, to be honest. So these videos are not playing, but so I'll just pull up a video of this so you can see this, because I have one from the other day. And then you could see the changes here. And certain body changes, like this is one session. We didn't even, same clothes. Look at the difference, how far forward in front of the line he is, where his head is. Look at where his head is here. So his posture looks 1,000 times better here. And that's because he's more centered over his body. Same here. Look how forward he is. He almost looks like he's trying so hard to hold himself up. This was after an optometry appointment. So he looks really different there. So same thing here, one session. No way, that's her in one session. I guess it's funny because I treated this woman like for over a year and her posture is significantly better now. This was our first session. So look at the difference. You can see such a significant difference. But I really should update this to her more recent posture change. I will. And then same here. This is one session. Like her center of mass is so wide because she has no idea where she is in space. Look at how low her right shoulder is. She left and she was like, oh my God, I feel so good. These are even more changes. So we worked together for 2 months, not even. This is a significant change. Like, yes, her head is still forward, but it's not where it is here. Like her shoulders are way back behind the line. So she really knows where her center of mass is. And in this picture, her entire head is over her right leg. She has no idea where left is. And now she's centered. So these are things that we see. And same here. So far forward, optometry glasses, she's back right over her feet. That video might not work. And then some references about stuff. But if you want, I can pull up a video. I'll stop the share first.
Girl, that is incredible. I know, I've been trying to see up your eye.
Yeah. I mean, here's a great change.
It's so long.
This was, I only did 2 sessions with this kid. This is before and this is after.
That is insane.
Look at how much compensation he has on the left. He doesn't have that anymore.
The head going down and the arms go up. Wow. I mean, we can't work alone. We can't do the things that we do by ourselves without, ignoring all of this.
Yeah, let's see if I can find anything else. I agree. It has to be, this is like way in the beginning. I have from, let's see. Well, you kind of got the point, I think.
Yes. And you are in New York?
I'm in New York. Yeah. I'm in Long Island. I have a clinic in Long Beach, Long Island. And then I also have a place in Manhattan, but I'll be in California in January for a few months, most likely.
Yay, exciting. Very good.
Yeah, I think I want to do California, Arizona. Some of those pictures actually were in Arizona and California because I usually try to go every year.
Oh, that's fantastic. Well, we have professionals that we work with and patients that we work with everywhere. So
amazing.
Very good to know where you're located, where you see patients so they can find you. To take your courses, do you mind sharing a little bit how we can get in touch?
Yeah, I mean, I'll send you the link also. So I have a course, it recently came out. It's called Rooted Well Foundations. And the idea of the course is that it gives you every foundation you need from a postural restoration perspective to get yourself to feel better. And it also educates you. So if you are this person who's like gone to a million providers and you can't figure it out, you're probably not going to find it by continuously going to that same provider or going to a conventional physical therapist, chiropractor. If they don't have this knowledge of what it's like to work with an optometrist or a dentist, it's, if you've been trying, and you might need optometry, you might need dental. And the problem is there's not many optometrists, dentists, or PRI providers that work in conjunction. So my idea behind this course was to help people get the information they need and start them off with all the foundations they need. So this course has 18 postural restoration techniques. So yeah, that's the page, the like sales page. Yeah, and so the idea is that I can give you techniques that can get you to feel better pretty quickly, at least to give you the foundations. If you do need more and you do need a dentist or optometrist, there's a live portion of my course where I'm helping people with that component. Wow. So the live video calls are like, I think I'm going to end up doing 3 calls a month. Right now it's just 2, but people have really liked it. And so people really want more. And so I'm trying to see what works for people. But every other week, we have these calls and people ask me a bunch of questions, ask me about their patients, if they're a provider, ask me about themselves. How do I talk to my dentist about this? And I can help them. So that's a whole idea, is I'm here to guide people to learn this stuff because it's really hard and there's not many providers.
100%. You're right about that. I had a couple questions about these splints. The patients, is it mainly for patients that are in pain?
It's mainly for patients that I have been working with that are not coming back into my clinic in a neutral body posture. Okay. And a lot of times they end up having some dental stuff, but sometimes you would never know that it's their teeth. They don't complain about their teeth. They're not looking for, They don't think it's a problem.
It's interesting. I always said, as a dental hygienist, that there was something so neurological about the way that your teeth come
Yeah.
together that we just, as a hygienist, I didn't understand about it.
Like an
And
eraser. So like if you bite every day, for me, I'm just gonna give you my example. I'm heavy on my right side every day, my whole life, since I got my braces off at, how old was I? 17, no, 15, I think. I got my braces off in
Mhm.
9th grade. I was corrected with a shift. So my jaw deviates to the left and I'm heavier on my right side, and I'm class 1 and class 2 on my left, class 1 on my right. Okay. That's very common. I am heavier on my right side. When I put my splint in at night, I'm even.
Mhm.
And I never feel my left molars throughout the day. I don't really ever feel much canines. Now I do because I've been in the splint for a long time. My canines don't touch. My left canine does not touch.
Mhm.
Because I've worn that splint, within the first couple weeks of wearing it, my eye level changed. It dramatically, because it evened me out so much from an ortho sense and then also from a neurological sense. So the feedback my brain got from wearing my splint changed significantly. I had back pain. I was a gymnast. I had back pain my whole life from, I don't know, 15 to like in
Yeah.
my 20s. Within 3 weeks of wearing the splint, my back pain was gone. And
Wow.
that's like what I see and what we do. But am I a dental patient? Could I have done ortho and myo? Yeah, I'm sure. But that was a very quick situation for me. And now I never have back pain, knock on wood. I sleep with the splint. I have a great smile. So to me, it's like doing ortho would be a whole situation. Maybe in
Mhm.
the future as an experiment. That's the only reason I would do something like that. But for a case like mine, yes, during the day, I still am heavy on my right side. For sure. It didn't fix it, but my brain can sense the left side at night. So my brain is able to calm down and not be so stressed out and so clenchy on the right side. I used to clench. I don't do
Mhm.
any of that anymore. So it's an
Wow.
eraser. Every night I'm erasing what I'm feeling all day, and my brain is getting a different feedback. That's what's so powerful of it.
That's
People don't fully, it's hard to grasp until you like feel it.
So, with wearing these appliances at nighttime, are there any TMJ issues, or do people or mouth breathing? Are their mouth open? How thick are they?
They're as thin as possible. They're like
Okay.
super, super, super thin. They're not mouth guards, so they're not thick. They are
Awesome.
sensory appliances. Like I don't like to call them mouth guards because they're really not, even though they might look like that one. They're only on the mandible. And of course, I'm still saying like, if you need to tape your mouth, tape your mouth. I've taped my mouth with that in and it's fine.
Mhm.
I always want to promote nasal breathing. And then your other question was,
I
what was
wonder
it?
if they're similar to a deprogrammer.
It is essentially,
Okay.
but it's not forcing you into any position. It's flat. So it lets your jaw move in whatever direction it wants, because that
Okay.
jaw needs to be able to move side to side.
Okay.
You can think of it as a deprogrammer. I call it sensory splint. That's just
Mhm.
a better way to explain it to people, because it's not really a mouth guard.
Mhm. And do patients wear it forever
No,
at
just a
nighttime?
little bit till they can feel better, maybe a year or two. I probably will wear mine. I've been wearing it for 2 or 3 years. I feel better when I sleep in it.
Mhm.
It's like shoes, like people, once they start
Mhm.
wearing a good shoe,
Yeah.
you know, uh, to me, I'll probably always wear a good shoe the rest of my life because I
Mhm.
feel better in one. Will I need to sleep with a mouth guard forever? I think for me, if I ever did ortho and got a really good bite, then I wouldn't need to. I don't think I need it. I've slept without it and I'm fine, but I feel better with it. My
Exactly.
system, as soon as I put it in at night, I'm like, ooh, okay, time for bed. Like my brain knows. So, and sometimes people have adverse reactions right in the beginning of getting it because it's such a nervous system.
Mhm.
You're really playing with the nervous system.
That is so cool.
Yeah.
If there's a patient that does require palatal expansion, do you
Yeah,
do the splints before to get them centered and
it's
get them,
hard. It's a really good
they're
question. It's hard
breathing?
because it depends on age, depends on price, it
Okay.
depends on all these other factors. If patients that are like my age or like for me, I've been in this splint now for 3 years. If I wanted to do palate expansion, now would be a good time.
Mm-hmm.
because my system can handle it. But if I did it 3 years ago when I had back pain and all this stuff, probably not. So even if you get somebody in a splint for like 1 year before they do palate expansion, they're going to have an easier time with expansion. And so, yes, but financially, are people able to do that? Sometimes these splints can run up to $2,000. And then they're spending what, 4, 5, 6, 7, 8K on palatal expansion. So like, it's really so person specific, finance specific. But
Okay.
if the world was ideal with like, you know, it didn't matter what people had money wise. And yes, I would say do a splint, do palate expansion and give them a splint after. But, and then vision, yes, vision can change if the body is not in a good starting point. So I've worked with my optometrist with one girl who was getting palatal expansion and her vision stayed the exact same. And we actually did a specific type of lens to keep her, because her vision was very rapidly increasing. They did a very specific type of lens to keep her eyes so that they wouldn't continue to change, and it worked. And so we didn't know, it was a bit of an experiment. I mean, I just let the optometrist do what she thought, and then
I mean, I literally just went through this. So I had MARPI, I had
Yeah.
palatal expansion done last year. And of course, at the same year, I turned 40. And my mom had, as soon as she turned 40, she had to get glasses. She never needed before then. And I noticed that slowly my vision was getting worse. And then all of a sudden, it got really bad. And so about
For
2
up
years
close
ago,
though?
yes, a little bit far and more up close. But I did 2 years ago. I just went to the optometrist this week on Tuesday.
That's funny.
And they compared to 2 years ago, and it is like so much worse. And I already have cranial strains. I mean, I already have all these issues. And of course, whenever you expand and you start pushing everything out of, out, the other cranial bones, they're not going to love you.
Yeah, it's hard. Have you done PRI with someone?
No, not yet. I know I have somebody 5 hours away from me. I know, but I really want to go. It was wonderful. I'm in Savannah area.
Nice area.
And it's beautiful down here, but we don't have many very specialized professionals into anything really medical. So it's a challenging area, but yes, about Atlanta, we have Seth Obras, which I've been talking to him forever, and I tried to make appointments several times.
I would say the biggest thing is whoever you go and see, make sure they have a dental and vision team.
Perfect. Well, Mike Cantrell does in Atlanta.
He's not PRI though, just so you know.
Mike Cantrell's not PRI. I thought he was PRI. Okay, Seth is for sure.
He was PRI. I don't consider Mike Cantrell PRI anymore.
Okay, he does have the dental and the vision.
Yeah. It's a bit different.
Okay, he does have the dental division team.
He does.
I don't know if Seth does, but I will reach out to them and I will figure out which one.
Just because if you are somebody who's done palate expansion, you want to make sure you're doing it like the right way with the right people.
I know.
Because you've already, I know you're going to be dental vision related just by what you're telling me. Now you might just need basic PRI techniques.
I hope so. I'm going to take your course.
Because now you you might just need all the basic stuff.
Definitely. I have to start somewhere.
5 to 10 PRI techniques for you might be enough for you to feel like different. That doesn't mean close-up vision is going to get better though. That might be.
I am starting a deprogrammer next week. Cois deprogrammer, and then try to check to see if my bite.
Let's see.
We can adjust that, and then PRI. I mean, there's so many components.
I know.
And it's so good for us to be going through these things, because recommending all these things to our patients, they also get overwhelmed. And we know that we are busy. We have, children's and businesses and life, and not all the time we're going to have amazing professionals really close to us. But understanding that there's a whole team that needs to be involved in the patient's care for us to be able to see these long-term changes, it is so important. Last question. Do you guys work with any patients with cervical instability? And what does that mean?
I mean, a lot of these things, patella tracking syndrome, all these things are catch-all terms for like, oh, your cervical spine is unstable. Like, what does that mean? I don't even exactly know. It's the medical jargon and all these terms that we put on things becoming really wild. And I do. I work with people that have C-spine problems for sure, because the C-spine problem is a rib cage problem, a pelvis problem, a foot problem, a dental, vision, etc. So it doesn't matter what the person comes to me with. I'm always going to look deeper. I've had people come to me with just tinnitus. Like
Mhm.
I've had people come with the most random of things. I had someone come to me yesterday for trauma. Like she has a lot of childhood trauma and she
Mhm.
wants help. She feels like she's having digestive problems. She came to me for
Yes.
that. So
Yeah.
like, yes, I work with people with cervical instability. I work with things like dystonia or like really complicated things, vocal issues. But
Mhm.
people have a lot of vocal cord problems. Like we can work with everything because we're looking globally. So
Mhm.
yeah,
Oh my goodness, that is fantastic. Well, thank you so much for
no
spending
problem.
an hour with us today. This has been such eye-opening, and you're really good at explaining things in a way where it's easy for us to understand. I will make sure that I share your link or information with our group on Facebook. Thank you, Angela, for finding Aleena and sending her over to us. And thank you so much for educating our public. We cannot wait for this to come out and everybody know on Area Circle who you are.
Send it to me. I'd love to share it.
Thank you so much. I really appreciate it. Have a wonderful Friday.
Bye.
Bye.